Hi, it's Paul Sackett, Good News Planet. I'm speaking to Leslie and Darlene, who work with the Ralph Lauren Center here in New York City. And hi, how are you both?
Oh, we're great, thanks. Thanks so much for having us.
Doing well, thanks.
Good. Well, I met you all over at something happening at the Apollo, actually, for health, a few weeks ago, and they just had their event this past weekend. I believe you guys were at that. And, well, tell us why you were at that, and then, two, tell us about the Ralph Lauren Center here in New York.
Okay. So the Ralph Lauren Center for Cancer Care and Prevention, we conduct a lot of outreach, reaching the community, and we learned through an outreach event about the Apollo Healthy Soul Festival and decided to get involved, and we were there on Saturday, as you said, reached hundreds of people and told them about the screening services as well as treatment services here at the Ralph Lauren Center.
And we've been in business for over 10 years, and our sole purpose in Harlem is to help people not only in the surrounding community but all 5 boroughs in terms of cancer screening and treatment for screenable cancers, and that would be breast, cervical, prostate, and colon. And nobody will be turned away in terms of lack of insurance or insurability. We have funding from the city, funding from different foundations, and private philanthropy.
Great. Oh, geez, this is good news on top of good news.
Thank you. We like to think so. We still need a lot more support. Miles to go before we sleep, but we're here for the underserved, and that's our mission in terms of providing the best quality care.
That's a big word, underserved. So does that mean if someone does not have insurance? I mean, insurance is becoming such a conversation here in America on who has, who doesn't, and who must have and who must give nowadays.
Right. It's a really good question. It's a really good question because I think underserved could be a middle-class person who has mediocre insurance. The way we define it here at the center is someone that does not have access to a quality care. So there are barriers such as racial, socioeconomic, but someone with mental illness, transportation issues. We really get down to a granular level. They say they can't get out of their home and be cared for. And corresponding with that, they don't have any insurance product, meaning they're not even on Medicaid. So our goal when they come into the center is to set them up with a financial counselor and figure out whether or not they are insurable. And if they are, put them on a healthcare product that works for them so they can get treatment. If they aren't insurable, we can work on some of the grant opportunities we have and put them on the grant, say for a colonoscopy.
Okay. Well, I know this stuff is very important. Actually, I just had a colonoscopy, and I'm going in for
Good for you. I'd like to hear that.
Well, I did have a problem. I had an emergency colon surgery January 6th this year, and I'm going in for the reversal on Thursday. So I'm very, very aware of and I just asked about a little baby polyp that they took out, went to colonoscopy. So, this is real talk. People really, I can only impress, as I'm sure you guys can only impress, the importance of getting a colonoscopy, the importance of preventive medicine for yourself, right? Isn't it so true?
I think it is. Prevention, we like to call it risk reduction because there's so many other things going on in this community in terms of the population we serve. And if we were to just, let's say, take patient A comes in the door, and patient A is 300 pounds, and patient A has breast cancer, and we work on sending patient A out for removal of the tumor and then radiation and come back on site for chemotherapy. And we don't work with patient A in terms of her obesity and any other comorbidities she might have. And comorbidities is in terms of, to define it for a lay person, as any other diseases that she might have incurred as a result of the obesity as well as the cancer. We've done her a disservice. We put her through this rigmarole on taking out a tumor, and she may die of cardiovascular disease. So our goal in looking at patients when they walk in the door is to look at the whole patient. Albeit we don't have primary care on site here, which we will eventually do, but our nurse practitioner is on watch for all these other things going on, and we want to look from the beginning on the screening side if there are things that we can get out of the mix before we even talk about cancer.
Nurse practitioners are online. We've done many stories with nurse practitioners and nurses overall in general for the last 15 years. They're hands-on. They see this stuff every day. I imagine you guys do a heck of a job. So where are you literally located, and how does somebody take advantage of your good things you're doing there?
We're really easy to find. We're right off of Marcus Garvey Park, and we're accessible by the 4-5 train, which is at 125th in Lexington. If you happen to come from the west side, the 2-3 comes up to Malcolm X Boulevard or Lenox Avenue, and you can walk across town or take the bus.
Why do you think Mr. Lauren got involved with it? I mean, we have him on many different times, and as well as Dylan, his daughter, and the whole family, in fact, over the years for a lot of the good things that they do. Why do you think that he's put his name on what you're doing over there?
I think there's a one-sentence answer, is that he, unlike many people, was able to cut through all of the smoke and mirrors and realize that healthcare is a very complicated system, and that even someone that he knew with capacity wasn't able to navigate the healthcare system and get appropriate care. And so the issue is, how do we help people? Even very smart people have trouble navigating the healthcare system. People with mental disabilities, or just think of yourself and what you just went through, which is a horrible experience, and how much you have to go through just to deal with your health care. But at the same time, you got to keep your job, feed your kids, do all of these things. And I think Ralph early on realized that there's such a disparity above 96th Street that, if you turn one way out of Mount Sinai, so to speak, your life is a whole different story. If you come north, you're out of luck. And we're here to support the people that don't have options. And we're not their last option, we're their first option, because we're able to support them in a way where we're looking at not only screening and treatment, but survivorship now.
Well, he's a Bronx boy to begin with, I believe.
He's a Bronx boy, and I think that there's a lot of different stories, but I think the short version is that he recognized how difficult it was for his particular friend to get care in terms of breast cancer, and so a big part of what we do here at the center is unfortunately, a thriving part of our practice is the breast cancer clinic run by Dr. Godfrey. And also now we have a nurse navigator on site, which is a fancy word for saying someone that's going to help you navigate your way through all the different systems that we've been talking about in terms of barriers, and help you understand your care and what you're going to go through before, during, and after your treatment.
Sounds really, really, really thorough. And thank you once again. 2 quick questions. Last one, the second to last, is what is your website also?
Our website is ralphlaurencenter.org.
Okay. And then the last question for each one of you is, what's good news for you?
I'd say good news for me is whenever I'm out in the community talking to an individual and they make that decision to just give their information so that we can follow up and call them to come in. So every individual, even if we talk to 50 and just one wants to come in, that could potentially be a life saved. They're getting an important screening. So that's good news for me.
Okay, and Leslie?
And good news for me is a foundation that came through out of nowhere that said that we want to support your clinical nurse navigation program to the tune of almost $500,000 over the course of 4 years.